Welcome to Talk. I'm your host, Elisabeth Vanderwelt, a holistic doula and a women's health coach, and the founder of Fruitful Womb Doula Services. This space is for every woman walking the path of a deeper healing. Maybe you're tending to your fertility or you're carrying life. Maybe you're grieving loss or you're stepping into motherhood now, or even easing into the wisdom of menopause. Here we honor the full spectrum of womanhood through story, nourishment, and sacred conversation. Feel free to follow us on social media and stay connected with the community. So let's settle in, breathe deep, and begin. So today we're going to take a deep dive into postpartum bleeding and that blood through menopause. We're going to take a deep dive into the postpartum bleeding, what is also sometimes called lochia. So I want to talk to you a little bit and go more into depth on passing blood clots after birth. So, as we all know, when you have a baby, there's normally 6 weeks-ish of bleeding afterwards. And sometimes, you can have blood clots associated with that. So, I wanted to talk to you about a piece from another midwife that I had seen where she loves to question the realm. And I'm not going to say any names because I don't want any hate on her because I love her. But I love reading some of these things, and I've saved a lot of these pieces. And I just want to share um, about blood clots a little bit and take a deeper dive and get your opinion even. So if you're listening, take a comment and tell me about your postpartum bleeding. So in your first 24 hours of bleeding, you will find that you will be bleeding heavier than a heavy period, and it should be bright red in color. It's, very normal to pass small blood clots, which are roughly about the size of a plum. And even you can have around one, maybe two clots that are larger, shape of the size of an orange. And oranges can be big. So, it's normal to experience like a gush of blood. So, when we're laying down and you get up and it's like, whew, that kind of happens a lot. And that's a lot of blood pooling in the vagina. So, if you're emptying your bladder frequently, it's very important um, to have that bleeding happen so that you're allowing the uterus to contract because our uterus expands when we have a baby. And when baby is born, it no longer needs to be this giant empty void. So it's going to start contracting to shrink down. So it goes on a little bit more to talk day to 3, 5. You're going to be bleeding, it's going to thin out, maybe become more pinkish. And then on days 5 to 10, it's going to continue and it should be maybe even yellow, white, or brown. And this is a very range of people, but from 10 days to 6 weeks, some will bleed on and off. And some can have it heavier, some can have it lighter. It can pick up sometimes if you are doing more heavier things and you're not letting your body rest and cooperate. So I really always like to tell people that it's normal to be bleeding. And with this midwife that I was talking about earlier, she wanted to talk about passing blood clots after birth. And she mentioned on it, why is it a bad thing if your blood clot is larger than the size of a golf ball? And my question, or in this case, her question was, why? So I love questioning thoughts. We have very standardized medicine today. We have many things where people are not questioning the whys and trying to find the answers, and that's where using our brain comes in power. And so she goes on here, and I'm going to continue reading a little bit, that blood clots are actually a very good sign. They are a plethora of heavy, thin blood. Oh no, I read that wrong because she says a plethora of heavy, thin blood would be much more concerning than a clot. Our bodies go through something called hypercoagulation during pregnancy, where the blood clots more easily. This is why postpartum women are at a higher risk of pulmonary embolism after birth. And as the placenta begins to separate from the uterine wall, it makes sense that the body would clot, even in large amounts, in an attempt to protect the body from hemorrhaging. Some people also have additional clotting factors from their genetics or from an immune disorder and may always pass large clots even when things are well. So, if you see a large clot after birth, it doesn't necessarily mean jump and run to the nearest hospital, midwife, However, there can be other factors that would indicate an issue. So these now are some of the issues that you can face when there is a blood clot. And that's probably why most hospital systems have it that if you're having a blood clot, come see them because, they do have sometimes more answers than the general person. But I love these whys, and that's why it inspired me to start this story or this episode today. So, one of the things that she mentions of issues that could arise would be pieces of the placenta or membranes that appear to be missing or stuck inside. So, if you're passing a blood clot, it could actually just be a piece of your placenta if it detached, or if there was issues along there. Maybe if you're feeling very extremely faint, or you're weak, or you're dizzy, and it's not getting better when you hydrate or when you have nourishment, and if you're resting properly. If you're still feeling that, then that's a good sign to go in when you're having a blood clot too. Now, if you're having excessive bleeding alongside the clot, so it's continuously going, 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 and then you're having the clots. And another one, if this is several days after your pregnancy, is if your milk is not transitioning after the several days. So this can indicate retainment. So when they mean retainment, it means retainment of placenta. There's so many things that could be going on there. So these are some of the signs that although it's questioned why to go to the hospital, here are the truths. Here are the reasons why we want to go to the hospital. So, if the uterus is not shrinking down progressively after birth, but again, if you feel absolutely fine, everything else appears to be great, and your intuition, that's a very big part of it, that's part of the brain analogy, says that you are well. Don't allow a simple medical suggestion out of a textbook impede on your ability to stay home. And another one that she mentions is just, you know, what what are the risks, right? What are the benefits? So the benefit of going to the hospital if it's a blood clot is sure, they're going to be there to help me if something is going wrong. But if you know that your placenta was fully intact when they came and they're like, say you had a hospital birth, they are like, yeah, your placenta is fully intact. We don't think there's any pieces. So then that should not be part of the reason there's a blood clot. If you're not feeling sick, like with dizziness, faint, weakness, and you're not having those, and it can be hard to tell, weakness, because you did just have a baby, but you should be feeling okay. So if you're not feeling okay as well as the blood clots, that's a great time to check in to go in. And so that's why something like that is so powerful because you are inspiring a why. So we have a lot of statements with medicals, and there is nothing wrong with medical healthcare. Like they help very powerfully a lot of things. And they're not there to be dissed. But there are times when a lot of it is very standardized, and a lot of us are so different. My body is so different than you who are listening to me. And we together are so different than another person who might be listening. So remember that you need to ask the questions using your brain method on how to properly learn the questions to be asked. So that if you just had a baby, you're not going to want to be going to the hospital over something that was totally fine in the end. And of course, you have to trust your gut. If you don't feel faint, weak, or you knew that your placenta was not, but you're still feeling like, man, something might be really wrong. I'm really worried about it. That's your gut speaking. That's your gut speaking, and that's your sign to go. A lot of the times with my health issues, and this is outside of birth, I'm consistently being told by people that, oh, why aren't you going to the hospital for that? You should get looked into that. And sure, when you Google it and Google says, this is something that normally we need a doctor for, or, like I've had strep and I didn't know it was strep. And so I was like, oh, this sore throat is not going away. And then you get all these scary results and you're trying to look into reasons why it would be. You yourself have to go beyond that. So, like with one of my more recent health issues, and I share a little bit this on my YouTube channel, I have been having one of the symptoms that are closer to like the final stages where they're normally like, well, we're not going to tell you the answer of what the problem is. We want you to go to the hospital. So for me, I'm not worried about it. I'm not sitting there thinking that this is the most life-threatening thing. I'm not concerned. My intuition is saying you don't need to go. So I'm trusting that intuition. I'm doing the research. I'm looking into how to take care of myself. So I don't see that it's a scary issue that needs to go in. And of course, bleeding is very different than my other health issues. But at the same time, you need to trust yourself. You always know what's best for your body. That's why even if you go to the hospital and you don't like what they're telling you, you can tell them no, because I don't think I need that procedure done. I don't think this needs to happen, because you are going to know what's best for your body. You're going to know, and you're going to have to make informed choices. And so that's where we get back into that question that that other midwife asked, was why? Why are we scared of blood clots when we have to look deeper beyond, oh, if it's this size, it's dangerous, you need to come in? Like, that's not a very informed decision. If I just tell you that it's a fear tactic, you're like, oh my, if it gets that big, it's so scary, I need to go in. That's not your real intuition speaking, because you aren't fully informed on the information regarding blood clots. So you need to remember to ask the questions when you're in the hospital or with your midwife. Ask them, what happens if I pass more than one large blood clot? What if I have four blood clots all at the same time? Then you can get information from them that is like, oh, well, this is maybe more of a scary thing. So that means that I should go in, right? Or what if I have a fever that's, greater than 38 Celsius? And I'm sorry for folks that use Fahrenheit. I don't know what the conversion is right now. But you know what I mean? If you ask the questions and you know what to decide, that means that you are making informed choices. So anyone that goes and tells you, oh, well, you can't really trust your gut, what does it know? It's going to know a lot when you have the answers. So if you know that when you completely soak an entire maternity pad, or you're bleeding so heavy in like 30 minutes or less, that's a lot of bleeding. That could be a postpartum hemorrhage. And you already have the answers to, what do I do if that's the case? So you already know that that's your intuition telling you, yep, I don't feel safe, we need to go in. So I hope that this helps a little bit for anyone that's going through blood clots. Um, it it's not easy when you always have to question things and become a decision maker for yourself. But I love to put these mini episodes together to talk about a tiny subject that, maybe gets you fueled up. So if you are currently expecting, or maybe, you've even gone past this time, I just ask you to, at your next appointment for anything that's going on in your life, ask the questions why. It's a very simple three-letter word, but it's something very powerful that will make you more informed as it goes on. I was, sorry to diss you dad on the internet, but I was just with my father in the hospital for kidney stones, and I told dad, I'm like, we need to ask the questions today. I was really dueling him hard. And I said to him, like, you need to ask the doctor these questions, because he's been suffering with kidney stones for the past 2 months. And they're pretty sure this is the same stone that is slowly, very slowly traveling through the ureter into the urethra and all that. And it's going so slow because it's been 2 months. And the last doctor that was on call the last time we were in the ER had said that there was a surgery that they do that's minimally invasive, that they go through the urethral glands for men. I will try to keep that as blank as possible for the internet, but really, that story, when we heard that, it made my father more fearful, right? And I mean, I get it. Like, poking around, operations, things like that are never fun. So when we were waiting and waiting for tests and things like that, I told dad, I'm like, we are going to have to ask some hard questions when the doctor comes. You need to ask them, what happens if we wait, right? What if we just leave it, see if we can pass the naturate? It's been 2 months. Can we wait another 2, 3 months if it takes time? And right away, you see, I asked the doctor that, because dad was like, oh, you just do it. So I asked him, and the doctor says, oh, well, there's a higher risk of infection then. Okay, so you know that then. So dad knows now the risk, that the longer he waits, he has a higher chance for a higher risk of infection. And asking those questions helps you gather the information to decide what to do. Because I am not dad. Dad is going to have to decide on his own on what risks sound worse for him and what is like the better option a little bit. So I really encourage you at your next appointments, or anything that comes up, really, just to ask the question. And get the information you need so you can make a decision that's more powerful. So I appreciate you listening. We're a little out of schedule today. I was supposed to meet with someone last week to record a podcast episode for the two. I've been trying to diversify it a little bit up so that it's solo episodes and with people, but there were some changes of plan, so we just have me again today. But that's okay because I feel like this was an invigorating conversation about asking why. And really, with blood clots as a whole, like, does it make you wonder how many people go in and it's non-emergent at that stage? So there's lots to go into that as well. I'm so excited that you came today to listen to this episode, and hopefully you come back next week. We've got hopefully a few more on the schedule that will come, and we'll get some great conversations going. Thank you again so much, and I hope to see you next week. Bye bye.